Hi, my name is Anna Johnson,
And this is Gail Krumenauer.
and we're here to chat about the new report out from the Employment Department. It's all about growing demand and workforce needs in Oregon's healthcare and social assistance sector. Gail, start us off with a few of the biggest takeaways from the report.
In short, healthcare and social assistance has dominated recent employment growth. The sector also has the largest number of job openings by far, and it's expected to lead future job growth over the next decade.
Let's unpack each part of that a little bit more. First, what's been happening with recent job growth in Oregon?
Between 2023 and 2024, Oregon employers added 5,700 jobs to non farm payrolls. That's a growth rate of 0.3%, and it's the smallest annual total non farm job gain in at least 3 decades, absent a recession. Now, job growth was not only slow, but also highly concentrated in private healthcare and social assistance. This one sector alone added 16,100 jobs, which was a growth rate of nearly 6% between 2023 and 2024. It reached an all time high of 301,000 jobs.
Is this a new trend for healthcare and social assistance in Oregon?
While private healthcare and social assistance stood out for fast job growth in 2024, the sector has a decades long history of fairly consistent growth. From 2001 to 2024, total non farm employment in Oregon grew by 24%. At the same time, private healthcare and social assistance grew by 92%. Now, Oregon's also similar to the US in this. For example, between 2023 and 2024, private healthcare and social assistance accounted for nearly half of all job gains in the US. And looking back over the past couple of decades, the sector has outpaced total job growth nationally by quite a bit as well.
That makes sense given the aging population in both Oregon and the US. As the population ages, there's a tendency for a greater need for healthcare services.
Mhm.
The second part you mentioned was hiring demand in healthcare and social assistance. What's been going on there?
Healthcare and social assistance has consistently been the top hiring sector in Oregon for at least a decade because it's large and it has a long run history of strong growth. As job growth has strengthened even more over the past couple of years, though, so has the share of all job vacancies that are in private healthcare and social assistance. So if we look back on average between 2013 and 2022, healthcare and social assistance made up about 1/5 of all private sector vacancies. And by 2024, it accounted for 1/3 of all job openings.
And we can expect the strength of private healthcare and social assistance job growth to continue into the future.
Between 2023 and 2033, Oregon is expected to add 170,000 jobs. That's a gain of 8%. Healthcare and social assistance is expected to expand by 13% and add the most jobs of any sector. Actually, 1 out of every 5 new jobs added in Oregon by 2033 will be in healthcare and social assistance.
What kind of specific healthcare jobs are expected to be needed the most in the coming years?
7 out of the 15 fastest growing occupations in Oregon by 2033 are related to healthcare. They include nurse practitioners, physician assistants, medical health and services managers, veterinarians, and veterinary assistants and technicians.
Is there anything else we should know about future employment trends in healthcare and social assistance?
A larger share of healthcare and social assistance job openings require some form of education or degree beyond high school than what we generally see for all other industries in Oregon. So, meeting those future growth expectations requires Oregon to have a sufficient pipeline of trained workers to meet the increasing healthcare demands of an aging population, while we're also seeing workers retiring in larger numbers in healthcare and in other sectors of the economy.
Very interesting. Well, thanks for chatting about the report today. Where can people find more information?
Thanks to you as well. More information about the report can be found at qualityinfo.org.